I hope everybody who has a chance to see this, frankly, even hearing myself, will take a few moments and just try every day to learn one thing that you didn't know about the history of Black folk in America and how it's helped to build this country. You'll know you're there when we don't have to have Asian American, Black American women's history, but that this is just American history of all sorts, and it is truly integrated, and we're all learning it in its purest form. When I think about it now, is it gives me the opportunity to personally reflect on all the amazing blessings that's been bestowed on me as an individual that then I hope I'm able to pay forward and pay now in terms of the opportunities that I've had because of the struggle that we as African Americans have endured over, let's face it, centuries. But beyond that, it also gives me the opportunity to really reflect and think about our contributions to the creation and the building of the United States. There's a lot of reasons why I think it's important to celebrate Black History Month in the medical sector or healthcare sector. Who was the first? It's a chance to talk about, all sorts of firsts. I think that's one of the things that we should have top of mind when we think about people like Dr. Charles Drew, who was the inventor of plasma. I think about Justina Ford, who was the first Black OBGYN in this state, and that she was unable to get licensed in a hospital, so she delivered babies at home. The two really big historically Black medical schools in this country and the number of physicians that they have educated over time, and then countless other things that we could talk about. But it is important to have a chronicling of those things in a way so that people can appreciate that we've had and have made incredible contributions to healthcare. It's also a chance to slow down long enough to reflect on our health. And I think that if there's something that I would put out as a dream for us, or a goal, or aspirational opportunity for us during this month, is actually to talk about Black health and the state of Black health, both from our mortality rates, whether it's maternal or just general, our health status, and think about it through a few lenses, not just the lens of this has been in some ways, that is the lack of really great health among African Americans is one of the many vestiges of the sociocultural issues and socioeconomic issues in the country. But more importantly, what can we as a people do about it and get some of those messages out? There's often really rich stories in the genesis of any one of a number of things that become a thing, a way to, a time to stop and celebrate. It makes me think about the work that went on to get Martin Luther King Jr.'s birthday viewed as a national holiday. And in this state, the number of times that the Webbs, in particular Wilma, had to go to the legislature, but by gosh, she was determined to get it done. And it's a wonderful story of determination, of focus, and a commitment to something that was bigger than all of us. People fought to make sure that our story was told. I think the other thing is that we've got a really important, seriously important work to do around pipeline and getting young African American kids and adults interested in careers in healthcare, and to get them exposure and access to rehabilitation, neurorehabilitation, given that there's a significant proportion of our folk who end up needing neurorehabilitation services, if only because of stroke, which is very common in African Americans, but also because we too suffer accidents, some of the very same accidents that bring folks to our hospital. So getting folks interested in careers in this, we know that it makes a difference in terms of patients' adherence to treatment, their sense of trust when they look and see a provider who looks like them.